So we are going to be talking about Crohn's disease. Do we even know what Crohn's disease is? It's another type of inflammatory bowel disease, that's related to our gut. So gut has so many different things, right, that's happening, and we want to make sure that we bring it out as much as we can. Gut health is so important. So hang on for 1 second while I get Dr. Erica. So just for 1 second, I'm going to add Dr. Erica right here, and she will be a doctor who specializes in gut health. Specifically, we are going to be talking about Crohn's disease today. And hello, hi, Dr. Erica, how are you?
Oh, hi, I'm good. How are you doing?
Great, great, great. So I was just telling our viewers that we are going to be talking about gut health, but specifically Crohn's disease today. And
Mhm.
and this is Dr. Erica, everyone. She's a naturopathic doctor. Anything you'd like to add about yourself? Why you specialize on gut health?
Sure, yeah. I was actually diagnosed with irritable bowel disease, so Crohn's disease, when I was 11, and that was sort of what got me into this program of naturopathic medicine. So I have had a lot of personal experience with it, and then also experience just through naturopathic medicine and treating patients with similar conditions.
Okay, well, I think let's just start with your personal story. I mean, that was a very young age when you were diagnosed
Hmm.
with disease, right? I mean,
Yeah.
11 is like you don't even know. And what happened? I mean, what was the reason why you were, why you had the Crohn's disease? Do you remember the cause and the symptoms?
Yeah, I definitely remember the symptoms. The cause of Crohn's disease and irritable bowel disease is still pretty unknown to us today.
Mhm.
So I have had a lot of doctors kind of ask me a lot of questions about that and try and speculate around what the cause could have been. But in terms of symptoms, it actually went on for, I think, about 8 months before I was diagnosed. So quite a
Mm.
while. A lot of the classic IBD picture is just having cramps, a lot of stomach pain, diarrhea, a lot of the weight loss, fatigue was a really big one, and
Hmm.
that's kind of across the board with irritable bowel disease.
Hmm. And but what was the cause? Were you on some kind of a strange diet? Like, were you eating burgers every day or something?
No.
That just
And that
happened.
would be easy. Yeah, it would have been easy if we could say something like that and it was
Okay.
that straightforward. But no, I think especially when the symptoms started, I remember my mom like really trying to eat a really clean, really healthy diet, and sometimes despite that, with irritable bowel disease, it kind of doesn't matter what you eat. It's like even a vegetable will cause stomach pain.
Oh my God. Oh my God.
Yeah.
Okay, so then, all right. So let's just go through your journey and then we'll come to what you do for your clients now, right? And I mean, that's very
Hmm.
inspiring. So what helped you in the sense? Did you seek out a naturopathic doctor? Did your mom seek out a naturopathic doctor at that time? Uh, how did you start getting well? Is the journey
Hmm.
that I want our viewers to understand.
For sure, yeah. So I had a pretty long journey to wellness. I didn't discover naturopathic medicine until maybe 5 years after I was diagnosed.
Oh my
So I
God.
kind of, yeah, so I went through the conventional medical system with trying a lot of immunosuppressant drugs. That's usually the go-to for IBD.
Hmm.
But eventually I found cutting out a lot of foods like dairy and gluten were really big for me at first.
Hmm.
I couldn't eat ice cream, couldn't have pizza, any of those really good foods that people love. Um, Once I found naturopathic medicine, I ended up doing a lot of different herbal therapies. Some amino acids like L-glutamine were really good for me,
Hmm.
and just changing diet quite a bit. Usually,
Hmm.
when IBD is in remission, that's when fiber is really okay to eat.
Okay.
And remission is when you're like free from symptoms, not in the flare
Hmm.
up.
Hmm.
Yeah, so those are kind of the main things for me. Stress management has been a really big one. I try and exercise quite a few times a week just to keep things regular and keep the mood okay. There's
Hmm.
a lot of different factors for IBD and based on the person too.
But so are you okay now? Like you're normal with your IBD? Do you still have any issues like diarrhea or anything like that?
No, I've been in remission for a few years now.
Hmm.
So that's been great. I'm doing both some conventional medicine and also diet and lifestyle factors and taking some supplements, which has really helped for me.
So let's talk about what are the supplements. So diet is, of course, we all know that the diet has to be there, exercise, stress management, sleep.
Yes,
These
yes.
are the key pillars for, for any naturopathic medicine. But
Hmm.
let's talk about what kind of supplements did you take? Not that this is a medical advice, it's just a story. It's her personal story. So please don't start taking supplements yourself.
Yes, definitely, definitely. Yeah, like you said, it does have to be kind of a one-on-one visit to decide what works best for people.
Mm-hmm.
But for me personally, I use L-glutamine.
Mm-hmm.
L-glutamine is kind of one of the main nutrients for the intestines and really helps with energy for that.
Mm-hmm.
So that was a really big one. L-glutamine I used in a powder form.
Mm-hmm.
And I would sprinkle it on my yogurt or shakes in the morning. Slippery elm was a really big one for me too.
Mm-hmm.
Slippery elm is actually a demulcent, which basically means it kind of helps coat the mucosal lining,
Mm-hmm.
which is really important because we do have that mucosal lining across our intestines.
Mm-hmm.
So slippery elm was a big one there. And then probiotics, which most
Yeah.
people have heard of before.
Yeah.
With IBD and with inflammatory conditions, often the number of strains in the gut actually decreases.
Mm-hmm.
So having a probiotic really helps kind of diversify the gut bacteria.
So when you said probiotic, then you also recommend taking prebiotic along
Hmm.
with it, right? So
Yes,
prebiotic and
yeah.
probiotic, right?
Yes, yeah, you know about that already, but
I'm
yeah.
not a doctor. I'm just learning when I talk to you guys every day.
Hmm. Yeah, prebiotics are a really big one too, as we're learning now, which is awesome. Even just increasing the amount of fiber in the diet really helps the gut microbiome,
Hmm.
which kind of goes back to diet again with the prebiotics too.
Okay. So tell us, what is the difference between Crohn's disease and ulcerative colitis? They're all gut related, right? The inflammatory diseases. What is the
Hmm.
difference between the two?
Yeah, great question. Yeah, so IBD is kind of the umbrella term, inflammatory
Hmm.
bowel disease, and then
Hmm.
under that we have Crohn's disease and ulcerative colitis, sometimes just called colitis.
Hmm.
With Crohn's disease, it's not just specific to the large intestine, whereas in colitis, usually it's just specific to the intestines. Crohn's
Okay.
disease can happen kind of anywhere along the digestive tract, which is
Hmm.
super great, great bonus. Um, yeah, there are some main similarities between them when it comes to the symptom picture, but usually in order to kind of differentiate between the two, doctors have to do more imaging and scopes to figure out which one someone has.
I see. So the diagnosis would be some kind of a medical imaging,
Hmm.
right? That
Yeah,
the doctor
exactly.
would do on your tummy, or I mean on your digestive tract, to understand whether it is in the intestine or it is somewhere else, right?
Yes.
Is it?
Yeah, that's
Okay.
correct. Yeah.
Okay. And the treatment, how about the treatment? Just on a high level, we're not
Hmm.
going into the details, but
Right.
the pillars are the same, I'm assuming, right? The diet. But is there
Hmm.
anything different for ulcerative colitis versus the Crohn's?
Hmm. Pretty similar approaches are used for both,
Hmm.
just because they are both inflammatory conditions. So that autoimmune kind of umbrella term of autoimmune
Yeah.
pharmacology
Hmm.
drugs are often used.
Hmm.
And we will try and use a similar approach in naturopathic medicine because we do have anti-inflammatories in naturopathic
Hmm.
medicine as well.
So the approaches are
But
the
it is
same. Yeah, the treatment protocols are the same for both the conditions.
fairly similar. Yeah, there will be some differences depending on what the person is going through. For example, sometimes when the intestines are impacted and absorption is an issue, often
Hmm.
people will have things like vitamin B12 deficiency,
Hmm.
because that is where B12 is absorbed in the intestines. So
Hmm.
in those kind of cases, maybe we would look at supplementing with vitamin B12.
Hmm.
Um, yes, there are some variations, but there is some pretty interesting research coming out with Crohn's disease now and treatment
Hmm.
approaches,
Hmm.
because we know the gut impacts so many different things.
Yes.
Psoriasis is actually a good
Mm-hmm.
example of something that's more common with people with Crohn's disease.
Mm-hmm.
I actually have psoriasis as well,
Oh.
and Yeah, so now they're finding that treatments for psoriasis are sometimes also working for Crohn's disease. So there are some
Hmm.
interesting overlapping factors there.
That's interesting. The psoriasis is can be very, like it's all kind of different type of psoriasis, right, on your skin. And then
Yeah.
there's also, I was reading there's a research on avoiding the nightshades vegetables, right? So
Mm.
is that also related to Crohn's disease? Like, when you're eating so much, should you avoid nightshades vegetables?
Mm. I wouldn't say overall, I wouldn't tell everyone with Crohn's disease to avoid nightshades. They
Hmm.
come up often just because a lot of people can be sensitive to them.
Yeah.
So usually that is something that sometimes we'll experiment with is removing those nightshade vegetables. And that's not just specific to IBD, but kind of inflammatory processes overall.
Hmm.
Yeah, I just saw someone in the comments that they
I
also
know.
have psoriasis.
Yeah, I'm sorry. So I think you should get yourself checked if the Crohn's disease, what Dr. Erica is talking about, right? The Crohn's cirrhosis.
Mm.
Yeah. And a lot
Yeah.
of it is detoxification of the body too, right? That's what at least the psoriasis and I mean, whatever I have read. Is there any detoxification that kind of is recommended for Crohn's disease also?
I wouldn't call it a detox so much because there are so many causes that you can't really avoid through a detox.
Yeah.
And detox is kind of a hard word to describe
Hmm.
and identify because our body already has processes in place for detox, like the kidneys
Yes.
and the livers, and we do that on its own.
Yeah.
But yeah, there can often be like a buildup of things that you have to just get rid of and flush out. Could just be dietary related too.
Hmm.
With psoriasis, though, the main link between that and Crohn's disease is in the gut, so like the gut microbiome specifically.
Hmm.
So often actually healing the gut and focusing on the healthy bacteria that are in there will in turn benefit psoriasis.
Okay. Well, I think it's like, I mean, it's unbelievable how gut has now related to so many other medical ailments, right? If you
Yes.
cleanse your gut, psoriasis,
Mm-hmm.
so many things. All right. Anything else you'd like to add before we wrap up? These are small sessions, tidbit sessions. We just want people to give hope, right? And that's why we bring the user stories like yourself, and you are a
Mm-hmm.
naturopathic doctor as well.
Yeah, totally. I would just say if anyone is looking for extra help, feel free to reach out. I'm always open if you are in Ontario. And yeah, I think the main ones would be the dietary factors, the stress management, and the lifestyle changes are kind of like your foundational baseline
Mhm.
places to start from.
Yeah. Well, thank you so much, Dr. Erica. I see people joining now. I'm sorry, we're almost ready to wrap up. You can watch the recording afterwards. We were talking about gut health, specifically Crohn's disease. It's an amazing story. Dr. Erica had Crohn's disease when she was 11 years old, and she has been in remission for the many, many years. And now she's a naturopathic doctor. She helps others deal with Crohn's disease. So that's what we've been talking about. Feel free to see the recording. And thank you again, Dr. Erica, for being with us.
Thank you. Thank you for having me.
Thank you. Bye bye.